let's talk about healthcare, because a report published last month by Euromonitor International says that the inability of Nigeria to effectively address the country's numerous healthcare challenges has contributed to the weakness of the local health system and increasing the sale of over-the-counter products. The report added that Nigeria has seen an already developing health and wellness trend on the back of experiences of the COVID-19 crisis. Damilola Aloba is a partner and consumer goods industry leader at EY West Africa, and he joins me now to broaden the issues on the consumer health in Nigeria. Damilola, it's good to see you. Welcome to the show tonight. We appreciate your making it on the line. What new trends are we seeing in the consumer healthcare sector in Nigeria, and why?
Thank you very much, both, and good evening to all our viewers. The healthcare sector in Nigeria is a very unique one, one that needs urgent attention, I would say. And what are the trends? The most obvious one is the brain drain that we are seeing. Brain drain is the numbers are increasing on a daily basis. One of 3 are living in Nigeria for greener pasture. In fact, the Nigerian Medical Association recently said that we have about 24,000 licensed doctors in Nigeria today. If you take that and compare with the population of Nigeria of about 20 million today, it's a big problem. So that's one foremost issue that I'd like to mention. The other one is around the fact that the double burden of persistently high prevalence of not communicable diseases and rising levels of rising prevalence of non-communicable diseases, is still there hitting us as a country. Death rates 9 per 1,000 women die at childbirth. And in the wake of all of this, you also see increasing levels of startups, healthcare startups, even though they are not attracting as much funding as the fintech counterparts. So you see that most of the funds, about 90% of funds going to the tech industry or startups, is going mainly to the fintech space. While just a small, less than 10% is going to health tech, which will ordinarily help to, reduce cost of providing a cost of health delivery. If we can embrace to drive our sector.
Well,
okay.
So I'm just going to ask you very quickly because of time. How do you think we can accelerate sustainable healthcare? Because our population is increasing. You just saw the latest number. There were now about 216 million. So either by those who are coming in from outside the borders, those our own population growth internally, we're growing bigger by size. So.
Well, I think the first thing is for governments at the state levels and local governments to ensure that the primary healthcare centers are developed. That's the primary level. We need to lay a lot of emphasis on primary health and preventive programs in Nigeria. And once that is done, the fund, the Basic Healthcare Provision Fund, which is meant for the vulnerable Nigerians, the poor ones that cannot afford healthcare, needs to also continue to be funded. There's an allocation by federal government to it, but that allocation is declining on an annual basis. So at the point in time, if we can address primary health, if we can increase, health insurance penetration, it's currently at 5% and below. If we can increase that to at least 20% in the next 2-3 years, that's going to create the opportunity for affordable healthcare. In Nigeria, what we need is affordable, quality, and equitable healthcare delivery. If we can do that and also ensure that the brain drain is addressed, what's the essence of doing all of this and doctors are leaving? And also another thing to that is to ensure that there's health infrastructure for the doctors to work with. So get the doctors on ground, make their compensation and salaries attractive, create the enabling environment for them to operate. And also, there's need for funding to fund the healthcare sector itself in terms of infrastructure, research and development, and also ensuring Nigeria needs to be self-sufficient in drug manufacturing.
Damilola, just a quick one. Damilola, just a quick one. So, Summit, I'm going to ask this question. Do you think some of the hospital facilities that the government currently superintend right now should be privatized or should be allowed to go to the private sector to make sure we have needed investment quickly?
I think before you privatize, you need to make sure that the right policies are in place. Like I said, if you privatize and yet it's not affordable, so privatize, but also make sure that the health insurance is there so that everyone can afford healthcare, quality healthcare.
I got it.
There's also an equitable health.
I think I love that. Let's democratize the healthcare system.
Two things I'd like to add. That government's budgetary allocation to the sector needs to increase. Currently, it's between 3 and 7% in the last 5-10 years. But the African Union Declaration said it should be at least 15% of the budgetary allocation. So if that increases, and there's political will to ensure that government prioritizes healthcare the same way they will prioritize education, then there's going to be significant improvement in the sector.
All right. Thank you so much for those insights tonight and your perspectives on my health and your health as well. Damilola Aloba, partner and consumer goods industry leader at EY West Africa. Have a great evening.